Have you ever felt a sharp pain shooting from your lower back all the way down your leg? Maybe your foot feels numb, your leg suddenly feels weak, or it hurts just to stand up. Many people assume it's just back pain, but it could be your sciatic nerve trying to warn you that something more serious is happening. In today's video, I'll explain everything you need to know about sciatic nerve pain, what causes it, when it's an emergency, and the treatments that can help you get your leg. The sciatic nerve is the largest and longest nerve in your body. It begins in your lower spine, travels through your buttocks, down the back of each leg, and into your feet. When this nerve becomes irritated, inflamed, or compressed, it's called sciatica. Sciatica isn't actually a disease. It's a symptom of an underlying problem affecting the nerve. Millions of people experience sciatica every year, and for some, the pain can be so severe that it interferes with walking, working, driving, and even sleeping. What causes sciatic nerve pain? Several conditions can place pressure on the sciatic nerve, including herniated or bulging discs, spinal stenosis, which is narrowing of the spinal canal, degenerative disc disease, spondylolisthesis, where one vertebra slips over another, bone spurs arthritis of the spine, trauma from motor vehicle accidents, or falls tumors, although this is much less common, piriformis syndrome, where a muscle in the buttock compresses the sciatic nerve. As we age, the discs and joints in our spine naturally wear down, increasing the risk of nerve compression. What are some common symptoms? Sciatica usually affects only one side of the body. Symptoms may include sharp, burning, or electric-like pain traveling from the lower back into the buttock and down the leg, tingling or pins and needles, numbness in the leg or foot, muscle weakness, pain that worsens when coughing, sneezing, or sitting for long periods, difficulty standing or walking, foot weakness, or what's called foot drop, where lifting the front of the foot becomes difficult. Some people experience only mild discomfort. Others describe the pain as feeling like they're being shocked with electricity every time they move. When sciatica becomes an emergency, what should I do? Most cases improve with conservative treatment, but certain symptoms require immediate medical attention. Seek emergency care immediately if you experience loss of bowel or bladder control, numbness around the groin, buttocks, or inner thighs called saddle anesthesia, severe weakness in one or both legs, inability to walk because of sudden weakness, symptoms following major trauma. These could indicate cauda equina syndrome, a rare but serious condition that often requires emergency surgery to prevent permanent nerve damage. How is sciatica diagnosed? Your healthcare provider will usually begin with a thorough medical history, physical examination, testing your muscle, strength, and reflexes, checking sensation in your legs. Performing the straight leg raise test, imaging may include X-rays to evaluate bone alignment MRI, which is the best test for identifying herniated discs, and nerve compression CT scans. If MRI cannot be performed, EMG, electromyography, and nerve conduction studies to assess nerve damage. Conservative treatments activity, modification not complete bed, rest, physical therapy, stretching and strengthening exercises, walking regularly, heat or ice therapy, maintaining good posture, weight loss if appropriate. Your healthcare provider may recommend acetaminophen, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen, if appropriate, muscle relaxants, certain prescription medications used for nerve pain, short courses of oral steroids in selected cases. If pain persists, an epidural steroid injection may reduce inflammation around the affected nerve and provide temporary relief. When is surgery needed? Surgery may be recommended if pain lasts several weeks to months despite treatment, progressive muscle weakness develops, significant nerve compression is seen on MRI, walking becomes increasingly difficult, there is loss of bowel or bladder control, cauda equina syndrome is present. Sciatic nerve pain can range from mildly annoying to completely debilitating. The good news is that most people improve with conservative treatment, but persistent pain, worsening weakness, or changes in bowel or bladder function should never be ignored. This video is for educational and informational purposes only and should not be considered medical advice. It is not intended to diagnose, treat, cure, or prevent any disease. Always consult your physician or another qualified healthcare professional regarding any medical concerns, especially if you have severe pain, progressive weakness, numbness, loss of bowel or bladder control, or other concerning symptoms. If you believe you are experiencing a medical emergency, call your local emergency services or seek immediate medical care. If you found this video helpful, please subscribe, follow, like, and share it with your family and friends. You never know who might be suffering from sciatic nerve pain and need this information. Also, leave a comment below and let us know what topics you'd like us to cover next. Thank you for watching, and we'll see you in the next video.